Aortic stenosis is one of the most common valvular diseases of the heart, and transcatheter aortic valve replacement, or TAVR, is a relatively new procedure that has been revolutionary in treating it. There are two components that are broadly applicable across technologies: clinical efficacy and financial viability. In this paper, we explore the financial viability of TAVRs using financial analyses at both the hospital level and the larger industry level. Our analysis at the hospital level suggests that TAVR is a technology whose financial sustainability is driven largely by a hospital's ability to control its costs. Our analysis at the industry level using a Porter's 5 forces analysis suggests that the industry will continue to grow, but there will be a significant first mover advantage.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.